Dear medicos, welcome to my YouTube channel, Indian Anatomist. Today's topic is right atrium. Dear medics, before going to right atrium, we will discuss the general introduction about the heart. The heart is a biologically sophisticated, self-regulating pump that utilizes both suction and pressure to propel and distribute blood throughout the entire body. The superior vena cava (SVC), inferior vena cava (IVC), and coronary sinus of the right atrium gather the deoxygenated or venous blood from the body and transport it to the right ventricle. From there, it is propelled into the pulmonary trunk and arteries, which carry it to the lungs for oxygenation. The pulmonary veins transport oxygenated blood from the lungs to the left side of the heart, which then pumps it into the aorta for distribution throughout the body. The heart is composed of 4 chambers, which include the right and left atria and ventricles. The atria serves as the chambers that receive blood, while the ventricles function as the chambers that discharge blood. Now coming to today's topic. The right atrium is one of the 4 chambers of the heart. The right atrium receives venous blood from the whole part of the body through SVC, IVC, and coronary sinus from heart itself. In general, the heart has 4 borders. They are right, left, superior and inferior. Out of these, the right atrium forms the right border of the heart. It also forms the anterior or sternocostal surface and part of the base, too. Now, how to reach the right border? It is very easy. The right border extends from the superior vena cava to inferior vena cava orifice. Now, it is the time to discuss the interior of right atrium. Interiorly, the right atrium has 2 walls. Number 1 is rough anterior or pectinate wall, and number 2 is smooth posterior wall or sinus venerum or interatrial septal wall. First, we will discuss the anterior wall. The pectinate wall is composed of cardiac muscle bundles that are arranged in parallel, like the shape of a comb tooth appearance. Pectin is a Latin terminology for comb. The anterior and posterior walls are connected externally by a vertical sulcus called sulcus terminalis, and internally by a vertical ridge called crista terminalis, situated along the right border from superior to inferior vena cava orifice. Dear medicos, see the illustration showing the pectinate or anterior wall is cut along the sulcus or crista terminalis, visible here and reflected towards the left side. Now coming to the posterior wall. Why is it called sinus venerum? Embryologically, the posterior wall or sinus venerum is derived from the absorbed part of the right horn of sinus venosus of the primitive heart tube. Towards the right ventricle, the sinus venerum makes contacts with the right atrioventricular or AV septum, which contains the right AV or tricuspid orifice. Now, the general features of the interior of right atrium are completed. Now is the time to discuss the special features of the sinus venerum of the right atrium. Inside, we can see 5 openings and 6 special features in the posterior wall of right atrium. First, we will discuss the 5 openings are: 1 is superior vena cava orifice. 2 is inferior vena cava orifice. At this level the SVC and IVC are terminating at these orifices. 3 is right atrioventricular orifice. 4 is coronary sinus orifice. And finally, number 5 is openings of venae cordis minime. Other special features of the posterior wall of right atrium are: 1. Presence of right auricle. 2. Intervenous tubercles. 3. Fossa ovalis. 4. Limbus fossa ovalis. 5. Valve of inferior vena cava or Eustachian valve. And finally, number 6 is triangle of Koch. Now, we will discuss each one of these special features. What is the right auricle or atrial appendage? The right auricle or atrial appendage is a small, ear-shaped pouch or extra room that sticks out from the antero-superior part of the right atrium, which overlaps the ascending aorta. The auricle holds more blood in the atrium. During the cardiac cycle, auricle helps the right atrium to fill up quickly. Pectinate muscles line the right auricle, help the walls of the atrium to contract. The same features are also applicable to the left auricle of the left atrium too, but it is narrower and longer than the right auricle. What is intervenous tubercle? It is a narrow, oblique muscular extension that lies between the SVC orifice and fossa ovalis on the posterior atrial wall. While less noticeable in adults, it is vital to fetal circulation. In fetal circulation, it directs the superior vena cava blood to the right AV orifice, but not the left atrium through foramen oval. Dear medicos, in this situation, I want to add some more points regarding intravenous tubercle. In fetal circulation, the inferior vena cava blood directs into the left atrium through foramen oval, and the superior vena cava blood into right ventricle through right AV orifice, which is directed by the intravenous tubercle. The next feature is foramen oval and fossa ovalis of the heart. Dear medicos, this is an important part of reading the right atrium, because these features, including the limbus fossa ovalis, are functional in fetal circulation. Any defect in the fossa ovalis causes atrial septal defects, simply called ASD. In fetal life, the foramen oval, or oval foramen, was situated in the interatrial septum of the right and left atrium. It permits fetal blood to skip the non-functioning fetal lungs and flow directly from the right to left atrium. Upon birth, the lungs promptly initiate their functioning and establish pulmonary circulation. Consequently, a pressure gradient occurs between the left atrium and right atrium, leading to the closure of the foramen oval, thus forming the fossa ovalis, which is an oval-shaped structure in the posterior wall of the right atrium. Coming one is limbus fossa ovalis. The limbus or annulus fossa ovalis is the distinct incomplete oval border for the fossa ovalis. It is more prominent above and on the sides of the fossa ovalis, whereas it is lacking below. Please see the illustration for information. Next feature is valve of inferior vena cava. It is also called Eustachian valve, referring to the rudimentary valve of IVC. In fetal circulation, this valve directs the nutrient-rich venous blood through inferior vena cava towards the foramen oval of the right atrium to left atrium. Finally, the left-out feature is triangle of Koch. Koch's triangle is an anatomical area containing atrioventricular, or AV node. Because of triangle, it has its own boundaries. Simultaneously, please see the illustration for easy understanding. They are anteriorly by tricuspid orifice in its valve, posteriorly by valve of inferior vena cava and tendon of Todaro, is a part of the fibrous skeleton of the heart, and the base is formed by opening of the coronary sinus. Dear medicos, we have completed the external and internal features of the right atrium of the heart. Now coming to the blood supply of the right atrium. The right atrium, including sinoatrial or SA node, which is situated below the SVC orifice, is supplied by several atrial branches from the right coronary artery. In most of the individual, the atrioventricular or AV node is supplied by the right coronary artery, but it may arise from the posterior descending artery, branch of RCA, or from left coronary artery. Now coming to the venous drainage of the right atrium. The small cardiac and anterior cardiac veins drain blood from the right atrium. The former vein drains into the coronary sinus, which in turn drains into right atrium, and later vein drains directly into right atrium through the venae cordis minime. The final touch of the right atrium is studying the clinical anatomy of it. Number 1 is patent foramen oval. Persistent foramen oval after birth causes smaller patent foramen oval. If the foramen is larger, then it is called atrial septal defect or ASD. Thus, the right atrium shunts the venous blood to the left atrium. Now, what are the complications of ASD? The commonest are right heart failure, irregular heartbeats or arrhythmias, stroke, early death, and high blood pressure in the lung arteries, also called as pulmonary hypertension. Number 2 clinical anatomy is the right atrial appendage, or auricle, is a potential site for formation of thrombus, can lead to pulmonary embolism. It is often excised in cardiopulmonary bypass. Finally, number 3 is fossa ovalis is used for transseptal puncture. It's a routine procedure for cardiac electrophysiologists to access the left atrium for ablation of atrial fibrillation. Here is the term septal represents the interatrial septum. Dear students, the lecture regarding the right atrium is completed. It is an important examination topic in cardiovascular system. If you have questions or queries, please post them in the comment box. We'll see you in one more video. Stay tuned and don't forget to subscribe my YouTube channel, Indian Anatomist. Good day all.